Hello, my name is Richmond, and today we're about to present some information concerning how to prevent and treat your arthritis naturally. As I said, my name is Richmond Bergner. I have a bachelor's in biomedical sciences, a master's in clinical and experimental medicine from University College London, and a PhD in clinical medicine from Imperial College London. Today, I can see that we have Sandra online, and Sandra from Pontypool. Nice to have you around. I'll dig straight in, use the chat features, and there's also a section for questions. If you have any questions as I present, you can put them in there and I will try my best to answer them. There's also a poll section where you can tell us what type of arthritis you have. Know that nobody would really know what specific type of arthritis you have would show up, but it would just give us an aggregate, a pool, so to say. Okay, let's go on then. So, what is osteoarthritis? Most of you who have osteoarthritis, for example, would already know what this is. It's symptoms are aggravating pain in the joint area. But actually, the most common form of arthritis afflicting humans is osteoarthritis, often referred to as degenerative arthritis, because the joints slowly deteriorate as a result of normal wear and tear associated with aging. So when you look at the healthy knee, you notice that the healthy knee has a nice layer of cartilage between the two bones. What happens with osteoarthritis is that there's an erosion of this cartilage, which then leads to the damage of the actual bone. And we call this the osteoarthritic joint. In this case, it's the knee. And it can happen also in the fingers. It can actually happen in all of your joints. Now, rheumatoid arthritis is very similar to this in a sense, because it's also an inflammation of the joints, which then leads to excessive pain. It's slightly more difficult to diagnose, as it's not just the erosion of cartilage that shows that one has rheumatoid arthritis. So it makes it a bit slightly more difficult to diagnose. So one of my goals for 2019 was to help so many people with arthritis as I possibly can in 2019 by offering free seminars, free online seminars, free webinars, and to teach them the power that they actually have, that they have actually power to help themselves reduce the pain that they go through. You can change your diet, you can change the way you do things that would positively impact your arthritis and thereby reducing the pain. All the drugs that you take, they're great. Some are not so great, but they actually help you reduce the pain, which is really important. So, doctors commonly advise people to lose weight, especially if they have diseases of the joint, of the lower extremities, and to avoid prolonged and strenuous use of the affected joints. Beyond this common sense advice, if you see a doctor for a painful condition, you most certainly receive a prescription for a painkiller. And this painkiller is usually non-steroidal anti-inflammatory drugs, which is ibuprofen, Advil, etc. I'm sure some of you must be on this already. And one can also receive methotrexate, tramadol, etc. Unfortunately, many of these same drugs have been have shown in research that they end up damaging the joints that they are supposedly helping. So it's like a chicken and egg situation here. Obviously, there's the need for better approaches to this common condition. It affects millions and millions of people around the world. And so, this is why I wanted to chip in, give my part, show what you can do at home to help alleviate your symptoms, thereby reducing the painkillers. I think the painkillers are great for the short term when you do have an episode, a flare. I think it does help, but it's not something you can actually stay on for a very long time. The long term effects of these drugs can be quite detrimental to your overall health. So, some of the side effects of these non-steroidal anti-inflammatory drugs are stomach pain, heartburn, stomach ulcers, a tendency to bleed more when injured, especially when you're taking these anti-inflammatory drugs uh, with aspirin, or if you're taking aspirin. You have a lot of headaches, dizziness. Some people even have ringing in the ears. Allergic reactions such as rashes, wheezing, and throat swelling is quite easy to acquire these side effects. Now, over the long term, what happens is that it's so easy for you to develop liver and kidney problems because of the prolonged use of the non-steroidal anti-inflammatory drugs. You also have issues of high blood pressures and also leg swelling. Your leg can also start swelling. So, what is the solution to arthritis? What can you do to alleviate yourself of this horrible disease? I mean, osteoarthritis is not an inevitable part of growing older. People can live a lifetime pain-free, with fully functional joints, actually. And I think that is the way it's supposed to be. However, commonly in the Western countries, the joints of people worsen with age. As you grow older, there is more pain, or one develops arthritis, which then starts getting worse and worse over time. Only 2% of women less than 45 years old in the US show signs of osteoarthritis. But eventually, through the use of x rays, we've noticed that 70% of people above the age of 65 years and older show signs and symptoms of arthritis. So my question is, what happens to people between the age of 45 and 65? What happens that the prevalence of arthritis moves from 2% to 70% all of a sudden? I mean, when you look at some African countries and some Asian countries, most of them actually, arthritis as a disease is actually quite rare there. And this makes you wonder, what could it be? Could it be because of the genetics? Could it be because of the climate? Or could it actually be because of their diets? And I actually think it's because of their diets, you know? So most of African and Asian countries rely on diets that's based on unrefined plant foods with few animal products and little and added with few animal products and few added fats. Unlike here in the Western world, one would enjoy a lot of McDonald's or enjoy mac and cheese. I mean, yeah. So it's quite obvious where we might, as a population, where the population might be going wrong. It might be our diets. So so the extra weight, the extra so the typical American diet damages the joints in several ways. Over two-thirds, which is 66% of the people on this high fat, high calorie diet from the Western world are overweight. And almost 33% are obese. So it seems that weight gain is a huge burden. And also, the extra weight damages the lower extremities, the hips, the knees, the ankles, and feet, simply through excess stress, the exaggerated effect of gravity on your weight, basically. But there are other reasons that your joints may be injured due to unhealthy diets. The first of all is malnutrition. You see, malnutrition from Western diets deprives the bones and joints of the raw material they need to become strong enough to resist normal wear and tear of daily activities. So yes, we have an abundance of food. I mean, you can eat so many calories if you're in the Western world quite easily by just going through fast food shops or just getting something really quick made up. You can take in so many calories. However, most of the calories we take here in the Western world are without nutrients. We need to start eating food that has a lot of nutrients, because without these nutrients, we will not be able to resist the normal wear and tear that we undergo. And this might be the reason why you see such a huge change between the people who are 45 years old versus those who are 65. There is also poor blood circulation to the joints. Due to the poor diet, circulation to these joints is usually compromised by fats floating in the bloodstream after a typical meal. Now, if you have fats floating around your blood, it's then going to be quite difficult for your cartilage to heal. It's going to be difficult for your joints to not be inflamed, so to say. So we need to reduce our fat intake, we need to start eating more nutritious food, etc. Now, the most damaging effect from the Western diet is inflammation, and it causes damages to the joints. And also, there's a lot of protein in dairy products that has been shown to also cause inflammation. Uh, and this inflammation ultimately leads to a permanent damage of the cartilage, basically the lining that covers the bone. So, the overall benefits of a healthier diet and weight loss are shown in a recent paper published in the American Journal of Clinical Nutrition. This study was titled Diet Induced Weight Loss, Exercise and Chronic Inflammation in Older and Obese Adults, a randomized clinical trial. Now, in this paper, there were 316 older, obese, or overweight, sedentary men and women with X-ray evidence of knee osteoarthritis. And they were assigned 4 different 18-month treatments to see the effect of those treatments on their diet. So one of the groups had healthy lifestyle, and this group was used as a control. Another group also had diet induced weight loss. So basically they reduced their calorie intake and allowed them to lose weight over the 18 months. There was also another group that underwent exercise, and another group that underwent diet plus exercise. Those who lost weight due to an improved diet showed a decrease in inflammation measured by a variety of tests, the X-ray and other tests. Exercise did not seem to make a positive difference in this study. So this is one of the biggest studies that was done. 316 people. They took 4 different lifestyle changes and check to see which of the lifestyle changes actually help to reduce inflammation the most. And they noticed that the biggest thing that one could do to change your inflammation in your body is to change your diet. That was the biggest measure that was it, and actually exercise did not seem to make a positive difference in this study. Wow. So I would have thought exercise is actually quite good, which has been recommended in all of our medical books, that exercise actually helps you, you know, reduce inflammation, helps your joints and all of that. But actually, exercise did not show any difference. What showed a difference and improvement in inflammation and thereby in their arthritis was that they changed their diet that led them to lose weight. Okay. So I have here about at least 25 studies that have been published today that show the benefit of low fat, low dairy, plant-based diet on inflammatory arthritis. So that is arthritis that stems from osteoarthritis or rheumatoid arthritis or any other form of arthritis. Because arthritis fundamentally is made up, is caused, or arthritis progresses faster, becomes more painful, becomes more detrimental with increased inflammation, which then ultimately destroys the joint. So, from all of these studies, this specific one, where it involves 316 people, and also the 25 other studies I have read and studied, the single most important factors for helping reduce inflammation is to change your diet. And they suggest that you focus on having low fats, you focus on having low dairy products, and adopt a vegetarian lifestyle or diet habit if you can. Now, in a person who has low fat, low dairy, and has a vegetarian diet, it is very unlikely that they will develop arthritis. And actually, most of the people I've worked with, the moment they adopt the low fat, low dairy, and vegetarian diet, within a very short time, you notice that the symptoms of arthritis subside substantially to the level that they get off most medications. Now, this is pretty astounding. And with this type of diet, you end up actually improving your overall health, which is quite amazing. So, the 2 foods that have been shown to also specifically eliminate arthritis and inflammation are cherries and beetroot. I know, cherries and beetroot. Cherries contain an array of polyphenols that decrease inflammation and oxidative stress. A recent research, a review article put together some work about some research that showed that cherries actually have a huge benefit in health. They looked at 16 human studies that had been around, and they looked at the effects of consuming cherry or cherry products on markers of inflammation, which were shown to decrease in 11. So out of all the 16 studies around the world that have looked to see whether cherries can actually reduce inflammation, 11 of them show that yes, they can actually reduce inflammation. And it does make sense. Now, we also have beetroot. I mean, I was quite surprised by beetroot, but a recent study by Petrovsky et al. Have showed that therapeutic administration of betadine-rich oral capsules made from beetroot extract actually alleviate inflammation and pain in osteoarthritic patients. I mean, this is research at its best. They've shown that cherries and beetroots can actually reduce inflammation and thereby reduce arthritis. Yet, most people who have arthritis don't know about it. And it pains me and it hurts me. And this is why I'm doing this webinar, to let everyone know that you do have a choice. You can help your condition by just changing your eating habits instead of being in agony and going about your days without being able to sleep properly, to move properly, do things that you'd normally like to do. So I've put together basically 7 tips for arthritis pain relief. Number 1, as I've been talking about, I believe wholeheartedly and based on scientific research that low fat, low dairy, and vegetarian diet combined with non-rigorous physical activity, so just walking, taking a nice walk, nothing aggressive, provides the best chance to reduce osteoarthritis later in life and even help those who already suffer with this condition. So from today, the ideal model is for you to eat low fat, low dairy, especially milk. Milk contains inflammatory factors that trigger inflammation like crazy. So reduce your fats, reduce your dairy, reduce reduce your meat intake. No more red meat, no more chicken, no more lamb, no more fish. Reduce all of that. I know there are studies that says omega-3 can help joint pains, etc. But relatively speaking, that has not been shown in the scientific research that we've looked at. So reduce your fat, reduce your dairy, and switch to a slightly vegetarian diet. Even if you would have some meat, just reduce the amount of meat that you usually have, and you would see a huge improvement. Yeah? So, secondly, I would like you to use something called the heat therapy. Now, heat loosens up stiff joints and muscles, it stimulates circulation and reduces muscle spasms. Try using heat pads or microwavable heat wraps, pain relieving creams to figure out which is most effective for you. Every person is different. As you try these out, you would notice which of them really works for you. Now, also, you need to protect your skin from direct contact from these heat packs. So please remember to use a thin cloth between your skin and the heat source. Now, a quick way you could do this at home right now after us speaking is to just take a towel, a wet towel, and put it into the microwave for 1 to 2 minutes, and put the hot towel in a plastic bag and wrap it in a dry towel, and you would get instant heat at no cost, and you can just put that on your leg. Yeah? Now, the next part the next tip is use cold therapy. So I just said use hot therapy. Now I say use cold therapy. If heat therapy isn't doing the trick, try cold therapy. Cold packs may be uncomfortable at first, but they can numb deep pain. Rubbing ice cubes and small bags of ice over the painful areas also reduces swelling and inflammation. Make sure you use a thin cloth to prevent skin damage, similar to the heat. Now, what I've recommended to some of my patients is that they can use both hot and cold. And how they should go about it is this: once you wake up early in the morning, you can do the heat therapy because it relaxes the muscles around the joints for you to start your day really active and being able to move properly. And in the evening, use cold therapy to minimize the inflammation from your daily activities. Great. Now, get moving. I am not advocating aggressive exercise. I'm just saying move. Yeah, many adults with arthritis don't want to move because it hurts. It's true. It's totally understandable. When it hurts, it hurts. But not moving actually makes the arthritis pain worse. It's important that you don't stay in the same position for too long throughout the day. And you need to move and flex and use the joints so that it doesn't hurt as much. You need to stimulate those joints. So it doesn't matter what fitness level you are at. Even walking around the kitchen or just getting up and going to the bathroom regularly is a very, very good tip. So if you say, "Oh, I don't feel like going to the bathroom," then it means you're probably not drinking enough water. So at this point, I would add one more point that you need to drink 1.5 to 2 liters of water every day. It will help massively reduce the inflammation in your joints. Yeah? Good. Fifth point. Now massage your joints. Having a you need to have a massage or a rub at the painful joints to help warm up and relax your joint areas. It's a great wind down activity and might help you actually to sleep better. Even if it's a gentle massage, even if the gentle massage is painful, try heating your hands before, or using lotions before. There are a lot of natural oils and lotions you can use nowadays that would help a lot. Now, the next point is for you to maintain a healthy weight. This is so vital and so important. I don't even know how much more I should stress on it. It's so important. Being a healthy weight at a healthy weight is better for your joints because more body weight equals more pressure to your joints. The heavier you are, the more joint pain you have. So you need to find a way somehow to reduce your weight. Did you know that if you lost 1 pound body weight, it would take 4 pounds of pressure off each of your knees? Just 1 pound. And this is just because of the way the dynamics of moving are, and the bioenergetics of moving are, and also gravity. So by losing 1 pound, you'll be able to relieve your knee of 4 pounds of pressure. Wow. So it should be your number one goal in 2019 to lose as much weight as you possibly can, to alleviate the pressure on your knees, to alleviate the pressure on your joints. I'm actually going to put together another webinar, again, probably free of charge later on, to show you the best way to lose weight with arthritis. I think it's really important that we get this correctly. we get this done correctly. Okay, so the final point, add cherries and beetroots to your diet. Taking cherries and beetroot capsules reduce inflammation levels in your body and can help decrease arthritis pain. The thing with cherries and beetroots is for you to have the effect that you'd to have the if to eat enough cherries for you to have an alleviating effects on your joint, you'd have to eat probably 1 kilogram of cherries and 1 kilogram of beetroot every single day, which is impossible. So I recommend you get yourself some capsules, supplement formula capsules of cherries and beetroots, which will help your body decrease inflammation naturally. And this is really a nice support to when you're trying to lose your weight, you're doing the heat cold therapy, changing your diet. Sometimes you do need a quick fix, and these cherries and beetroot capsules are a quick fix. So we've actually developed a product called VitaSpark that has these cherries and beetroots. And when you actually go below and at this webinar, you'll be able to find an offer that we've put together for you, which is actually quite good. So, talking quickly about this cherries and beetroot, we've put together VitaSpark. VitaSpark is basically beetroots and cherries that have been freeze-dried, extracted, and put into capsules. And VitaSpark has 60 capsules. And these 60 capsules, you will need to take one in the morning and one in the evening. And this will help you reduce your arthritis, it will help you reduce your inflammation. And you can this is a 1 month supply. So normally we sell this for £50 and add shipping to it, which is £10, which gives you a total value of £60. So let me ask you a question. If right now I told you spend £60 and for 1 whole month reduce your arthritic pain, have reduced inflammation, have reduced pain, would you not do it? You would straight away. I would. And the beauty of this beetroot and cherry extract is also that it has minimal there are no side effects whatsoever because they're food products. They are food extracts. And whether you're on any medication like non-steroidal anti-inflammatory drugs or any other drugs like methotrexate or tramadol, you can still take the VitaSpark because it's a food product. It's like eating food. You can have this supplement with anything else you are on. And for the first 50 buyers this month, we're giving a limited time offer of $29.99. You can get this VitaSpark sent to your home within a very short time for $29.99. And for the month, you would feel so good and you would notice the difference the moment you start taking this. There's the link down at the office section. Once you go onto the website, you'll be able to see so many testimonials of people who are enjoying this, video testimonials. You have also written testimonials. Now, the beauty of all of this is that there's also 60 days money back guarantee. So if you try this and at the end of the month, this didn't help me one bit, then you just send me the empty bottle and then we would refund you your £30, your $29.99 back to your accounts. So don't let this opportunity go to waste. Make use of it and help yourself relieve your pain. This year, 2019, it's my number one goal to help as many people as I can relieve their arthritic pain. And I hope you help me to do this together. So we do this together. So I hope you enjoyed this webinar today. I enjoyed it tremendously. If there is anyone that has any questions, you could write it in the question section. If there's anyone that has any suggestions, you could write it in the chat box. And do go to and use the offer. There's nothing you're losing. There's a 60-day back money guarantee. You pay $29.99, and this formula, VitaSpark formula, will reach your home on a first class post delivery, and you don't have to pay any extra post costs. So make use of this definitely, and that's it. Okay. So I'd like to say a very big thank you for joining this webinar today. I am very, very pleased that you were able to join it today. This year, Vitanana is going to change lives. We are bringing health back to patients that have not had health in the past. And thank you for being part of it.